When I'm assessing the spinal structure, I'm looking for where it is that the body is maintaining symmetry and looseness, and where it is that it's gone from that state towards a state of rigidity and locking. In the case of my patient here, we actually have some distortion within the neck region in the lower sections of the neck, where I can feel that the spinal structure is more rigid than it should be. This type of motion palpation evaluation allows me to assess where it is that the vertebrae are moving well and where it is that they're actually locking up and causing pressure on the nerves that they house and protect. When they're locking in that way, the protection that they're supposed to give to the nerves actually damages those nerves. My job is to find whatever gentle, effective way that I can to release the tension within the spinal structure and, as a result, take the pressure off the vital nerve tissue. As I work to look at the spinal structure here, I can see that there's a left lateral distortion of the mid-back. Then the spine starts to go back towards midline through this region here. And as I look down in the pelvic region, I can see that there's a high hip on the right compared to the left. This foundation of the spine is distorted, and as a result of the way that it's lifted on one side, it's causing the whole lumbar spine to take off at an angle. If our patient didn't have what's called a righting reflex to keep him upright, he would literally be canted to the side as a result of the way that his pelvis is distorted. But his body is compensating for that distortion pattern by pulling him back upright like so.
I came to Dr. Blisko, I think around 7-8 months ago. I was having big time trouble with my back hurting. I tried to follow the procedures that the system had made up, meaning going to a neurologist and from there to physical therapy. From that point on, to no result of this, I was still in pain. My wife then persuaded me to come out here to see Dr. Blisko. A little hesitant at that time, and I didn't really know whether I wanted to do it or not. But the pain was so bad, I decided to make a choice. And this is where I'm at right now. I came out to see him. The first day, I was in such pain, and he worked on me, whatever he did, on my back, and popped. I got up. He said, "How you feel?" I was great, and I've been going ever since.
Why do I call the nervous system the master control system? The nervous system coordinates every function within your body. It's comprised of the brain, the spinal cord, and the spinal nerves that run out to every organ, every cell, every tissue. Those nerves communicate an intelligence. The intelligence is actually running through the nerves at trillions of impulses per second, not only to the outside of the body, such as the arm region, neck, shoulder area, but also the deeper organ structures inside. If you have a pain on the outside of the body, such as neck pain or arm pain, it could be related to organ dysfunction inside. The most extreme example of that would be left arm pain with a heart attack. But the fact is that you can have left arm pain with heart irritation without the heart actually going into arrest. It's important to understand that every time the nervous system is impacted by the traumas of some kind of mechanical dysfunction within the spinal structure, and you feel pain on the outside, it's a warning sign about deeper organic dysfunction inside as well. So each time that we work with you and we unblock that nervous system's ability to coordinate function, we're actually unblocking that nervous system's ability to coordinate function deep inside to the structures as well. The adjustments that we render release tension on the nerves and allow the organs, such as the kidneys, which are very vital, the pancreas, the stomach, all to function better each time you feel the spinal structure release in the areas where the nerves flow out to those organs. Opportunity to share with you my insights about the importance of a healthy nervous system, and also for the opportunity to serve you, to care for you, and to allow you to function better, feel better in your life, express the best possible health that you can. It's what I'm here to do, and I'm looking forward to delivering that to you. Thank you.